Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is staffing pattern and functions of primary health center. Staffing pattern and functions of primary health center. Primary health center is a basic health unit or basic health institution, okay, government institution to provide an integrated healthcare services. Integrated means preventive, promotive, curative, rehabilitative, restorative and palliative care all comes under integrated healthcare services to both rural and urban population, both in rural area and urban area, rural and urban population, that is individual, family and community, with emphasis, it give importance with emphasis on preventive services, promotive services, curative services, restorative or maintenance services, rehabilitative services and palliative care services, that is palliative aspects of the health care. Okay, actually it is started in 1952 under community development program. So primary health center in India launched in or started in 1952 along with the community development program. So it is a basic health unit or institution to render the integrated health services to both the rural and urban population. Next is types or categories of primary health center. Types of categories of primary health center. Under Indian Public Health Standards for PHC 2022, in the section 4, it is clearly mentioned about the types or categories of health wellness centers, primary health center, and its population norms or population coverage. So section 4 IPHS 2022 PHC explain in detail about the types and categories of health wellness centers PHC. Primary health center under Ayushman Bharat is classified as or converted or modified or renamed as health and wellness center, primary health center, and it has in rural area, urban area. Okay, so name of the center according to IPHS 2022, the primary health center is named, or under Ayushman Bharat, it changed its name as Health and Wellness Center, Primary Health Center, HWC PHC. Okay, types or categorization of this Health and Wellness Center, Primary Health Center. In rural area, it is called as Health and Wellness Center, Primary Health Center. In urban area, there are two primary health center. One is Health and Wellness Center, Urban Primary Health Center, and second one is Specialist Urban Primary Health Center or Polyclinic. Okay, it is a group of multiple or number of clinic that is called Specialist Urban Primary Health Center or Polyclinic. So classification of primary health center is classified according to the area, that is rural area and urban area. In rural area, the primary health center is known as Health and Wellness Center, Primary Health Center. In urban area, there are two primary health center. One is Health and Wellness Center, Urban Primary Health Center, and another one is, the next one is Specialist Urban Primary Health Center or Polyclinic. Then third point is the population norms of the primary health center. Okay, in the rural area, Health and Wellness Center, Primary Health Center, if it is situated in the general or in the plain area, it covers a population of 30,000. Okay, so Health and Wellness Center PHC in rural area, in the plain area or general area, cover a population of 30,000, and hilly, tribal, other backward area, it covers only 20,000. Then population coverage of Health Wellness Center urban PHC is 50,000. Okay, population coverage of urban PHC, that is HWC UPHC, covers a population of 50,000, and Specialist UPHC or Polyclinic cover a population of 2.5 lakh to 3 lakhs. Okay, 2,50,000 to 3 lakh people, 3 lakh population. Okay, this is about the categorization and population norms of primary health center as per the section 4 IPHS 2022. The third section is staffing pattern of PHC. Staffing pattern or human resource or manpower or health personnel of PHC primary health center. The staffing pattern of a primary health center PHC typically include a mixture of a group of different categories of health personnel, that includes medical staff such as medical officer, staff nurses, etc. Then paramedical staffs, then supportive staff, that is support staff, and additional staff, that is for the administration's activities. So all that is optional, that is not mandatory. So government is given optional, essential and desirable staffing pattern. Okay, so medical staff staff, paramedical staff, support staff and additional staff, that is optional staff. So these are the 4 categories or mixture of staffs present in the primary health center. Under IPHS for PHC 2022 in the service provision, that is the 8th section is service provision. In that 8.2 human resources for health is clearly explained or given about the staffing pattern of the PHC. IPHS 2022 specified the human resources or staff for the PHC in different categories such as rural PHC, urban PHC, polyclinic, 24/7 hours functioning rural PHC and 24/7 hours functioning urban PHC. Okay, and moreover they have given that what are the essential staff is required and what is desirable. Okay. So first one is regarding medical officer, that is MBBS medical officer. In that one is essential in the rural PHC, remaining all urban PHC, polyclinic, 24/7 rural PHC and 24/7 urban PHC it required 2 essential. So 2 MBBS medical officer is essential in urban PHC, polyclinic, 24/7 hour rural PHC and 24/7 hour urban PHC. Then second one is medical officer of Ayush. Okay. Actually, it is not essential in the rural PHC, urban PHC or polyclinic, but it is essential in 24/7 hours rural PHC. Okay. If the rural PHC function for 24 hours into 7 days in a week, then third one is medical officer dental. It is not essential for in rural PHC or urban PHC, but it is essential in polyclinic. In the essential in both the polyclinic and 24/7 hour rural PHC. Then regarding other specialist, okay, other specialist is required only in polyclinic. Okay, in the urban area government is having special clinics. In that specialists are required. That is one specialist is required in one polyclinic. Okay. Then fifth one is staff nurses. Okay. In rural PHC, 2 staff nurses are essential, and in urban PHC, 1 staff nurse is essential. In polyclinic, 2 staff nurses are essential, and in 24/7 hours rural PHC and 24/7 hour urban PHC, 7 staff nurses are essential respectively. Okay, that is 2, 1, 2, 7, 7. Then regarding pharmacist, 6th one is pharmacist. So in all the different categories of PHCs, minimum 1 pharmacist is essential. Okay, 1 pharmacist is essential. Then 7th one is lab technician. Okay, so lab technician is essential in rural PHC, that is 1, urban PHC, that is 1, polyclinic, that is 1, and remaining 24/7 hours rural and urban PHC it required 2 respectively. Okay, 2 lab technician in 24/7 rural PHC and 2 lab technician in 24/7 hours urban PHC. Then regarding health worker female and auxiliary nurse midwife. So 1 is required in rural PHC. So it is mentioned with a single star, that is 1 in 5,000. Okay. In rural PHC, for every 5,000 population, 1 ANM or health worker female is required. And at the same time, in urban PHC, 5 is required, that is 1 in 10,000 population. Okay. So for every 10,000 population in the urban PHC, 5 ANMs or 5 health worker female is required. So in the polyclinic also same 5 health worker female or ANM is required. And 24/7 hours rural PHC, 1 is required. But 24/7 hour urban PHC, 5 ANMs or 5 health worker females are required in 24/7 urban PHC. Then regarding health worker or health assistant male, okay, health worker male or health assistant male, in both rural and urban PHC, the essential number is 1 health worker male or health assistant male, 1 for rural PHC and 1 for urban PHC, and even 24/7 hours rural PHC also need 1. Okay. Then polyclinic and 24/7 urban PHC, it is not required. Okay. Then 10th one is health assistant female or lady health visitor. Okay, health assistant female or lady health visitor. It is required 1 in all the categories of the different primary health center as per IPHS 2022. So 11th one is health educator or counselor. Okay, so health educator or counselor is required only in polyclinic, that is only one is essential. So one health educator or counselor is essential in polyclinic. Then 12th one is dresser. So in all the categories of PHC, one dresser is essential. Okay, so dresser is essential, one in all the PHCs. Then 13th one is LDC one, that is lower division clerk one or accountant, either LDC or accountant. That also one is essential in all the categories of primary health centers. Then 14th one is data entry operator. Okay, data entry operator also one is essential in all the different categories of primary health centers. So one is essential. Then next 15th one is optometric or ophthalmic assistant or vision technician. Optometric or ophthalmic assistant or vision technician, that is required only in the polyclinic of urban area. That is one is essential. So one optometric or ophthalmic assistant or vision technician is required in polyclinic or essential in polyclinic. Then 16th one is dental assistant. Dental assistant is actually, it is desirable. It is not essential in any categories, but it is desirable in all the categories of primary health center as per IPHS 2022. Then 17th one is cold chain or vaccine logistic assistant. Cold chain assistant or vaccine logistic assistant to maintain the account of the cold chain, that is cold chain or vaccine logistic assistant. It is desirable in rural PHC, urban PHC, polyclinic, but it is required one essential in 24/7 hours rural PHC and 24/7 hours urban PHC. So one is essential is both in 24/7 hour rural PHC and 24/7 hours urban PHC. Then 18th one is physiotherapist. Okay, so physiotherapist also required or mandatory or essential only in polyclinic, that is one. So one physiotherapist is essential in polyclinic. Then 19th one is public health manager. Public health manager is essential one in urban PHC and polyclinic and 24/7 urban PHC. So both urban PHC one is essential and polyclinic also one public health manager is essential. The last one is 20th sanitation staff. Okay, cleaning staff, supportive staff. So in rural PHC and urban PHC, one sanitary or sanitation staff is essential, but in polyclinic 2 sanitation staffs are essential, and in 24/7 hours rural PHC and urban PHC 4 respectively is essential. That is 4 sanitation staff is essential in 24/7 hour rural PHC and 24/7 hour urban PHC. The total staff manpower or human resources required in rural PHC as per IPHS 2022, that is essential is 12 numbers. Okay, so 12 staffs are essential or manpower is essential in rural PHC and 2 staffs are desirable in rural PHC. Okay, then in urban PHC 17 staffs are essential and 2 is desirable. Then in polyclinic 23 staffs are essential and 2 is desirable. Then in 24/7 hour rural PHC 25 staffs are essential and 1 is desirable, and at the same time in 24/7 hour urban PHC 37 staffs are essential and 2 is desirable. So these are the total staffs required in the different category of PHC according to IPHS 2022, that is rural PHC 12 essential, urban PHC 17 essential, polyclinic 23 staffs are essential, 24/7 hours functioning rural PHC 25 staffs are essential, and 24/7 hours functioning urban PHC 37 staffs are essential. Then desirable staffs are 2 in rural PHC, urban PHC, polyclinic and 24/7 hour urban PHC, and 1 is 24/7 hour rural PHC. Then in addition to that, under NRHM scheme, National Rural Health Mission, 2 additional staff nurses are required at contract base in all the different categories of primary health centers. So these are the human resources for health services at various categories of primary health center under IPHS 2022. The last section is functions of primary health center. Functions of primary health center. I have been made a mnemonic as per the services of primary health center under IPHS Indian Public Health Standard Primary Health Center 2022, that is primary health care services. Primary health care services. P stands for palliative care, rendering palliative care. R stands for RCH services, that is reproductive and child health care services, including MCH, maternal and child health and family planning services. Then I stands for implementation of all the national health programs in the PHCs. Okay, implementation of various national health programs. M stands for medical care, okay, rendering curative services, that is medical care both in OP and IP, outpatient services and inpatient services in the PHC. Then A stands for administrative and maintenance services. So office services, okay, administrative and maintenance services in the PHC. Then R stands for referral services, making referral to community health center or subdivisional hospital or district hospital, referral services from PHCs. The next is Y. Here you have to remember, instead of Y I have made vital statistics. So collection and record of the vital statistics of the people under the jurisdiction of that PHC, whether it is rural or urban area. In that area, or how many wards are covered by the PHC, they have to make a vital statistics, that is collection of death, birth, etc. Okay, that is Y stands for vital statistics collection and record. The next is health. H stands for health education. It includes IEC, Information Education Communication, that is modified as BCC, Behavioral Change Communication, and even SBCC, Social and Behavioral Change Communication. I have been already uploaded a video of Principles of Health Education, you can watch that, and even Strategies of Social and Behavioral Change Communication also I have been uploaded. So if you have not watched that video, you can go through that. You will get good information about the principles of health education and various action plans of social and behavioral change communication. Then E stands for emerging and re-emerging diseases preventions. So of course there are many emerging and re-emerging diseases. So that prevention is one of the important function of the primary health center. It includes prevention of communicable diseases, prevention of non-communicable diseases, and prevention of locally endemic diseases that is common to that particular area where the PHC belongs. Okay, locally endemic diseases. So prevention of communicable disease, non-communicable disease, and locally endemic diseases under emerging and re-emerging disease prevention. Then A stands for various adolescent health services through the PHC. So adolescent health services for the adolescents. Then L stands for laboratory services. So providing basic laboratory services as per the IPHS standards 2022. Then T stands for training and supervision of all the different categories of health personnel or staff of the PHC. So T stands for training and supervision of all the health personnel or all the staff which belongs to the PHC. Okay, their training and continuous supervision. Then H stands for health care for the elderly people. Okay, geriatric nursing, health care for the elderly people. There are various national health programs for the elderly people that is implementing through the primary health center, that is health care for elderly. Then under care, C stands for conducting various clinic and camp. Okay, clinic and camp services. Okay, like immunization clinic, antenatal clinic, and other specific diabetic clinics, etc. And conducting specific camp throughout the year in the primary health center. Then A stands for antenatal, intranatal, postnatal services. That also is a part of the MCH services. It includes even child health, newborn care services, etc. So A stands for antenatal, intranatal, and postnatal services, MCH services. Then R stands for maintenance of the various records and reports belongs to the PHC. Then E stands for elements of primary health care. So rendering all the elements of primary health care, even it includes WASH, that is providing water and sanitation facility for the community people. So elements, I have been already uploaded a video of primary health care. You will get 8 elements of primary health care. Okay, you can go through that. E stands for education, L stands for prevention and control of locally endemic diseases, E stands for expanded program on immunization, that is immunization to the vaccination to the children, and M stands for maternal and child health MCH services. Then E stands for provision of essential drugs through the PHC as per IPHS 2022, supply of free of cost medicines. Okay, T stands for treatment, that is curative services or treatment for the minor ailments. Then S stands for safe water supply and sanitation. Okay, Then last, services. Okay, S stands for school health services. So conducting school health program in the various schools that belongs to the particular PHC, that is school health services or school health program. Then E stands for essential and desirable services as per the IPHS for PHC 2022 guidelines, that is rendering essential and desirable services to the public. And R stands for conducting research in community health nursing with various community related topics. So research in community health nursing. Then V stands for various outreach services at the community. So outreach programs, for example village health and nutrition days, urban health and nutrition days, etc. So to conduct the outreach services at community level. Then I stands for indoor patient department services. So PHC, you know that there are IP facilities. For that services comes under indoor patient department services, that is management of the ward, management of the patient unit services. Then C stands for comprehensive primary health care, rendering the 12 packages of comprehensive primary health care. So under Ayushman Bharat, the primary health care is modified into comprehensive primary health care, and it includes the 12 packages. I have been already uploaded a video that is comprehensive primary health care, so you can watch that video and will get the clear-cut information regarding all the 12 packages and other aspects of comprehensive primary health care. Then E stands for evaluation and monitoring, that is continuous monitoring and evaluation of the all the programs and services of the PHC to update and maintain the quality services, and continuous monitoring and evaluation of the all the staff functioning in the particular PHC. The last S stands for surgical procedures, that is conducting minor surgical procedures in the minority of the primary health center, especially in urban primary center, etc. Okay, so S stands for surgical procedure, that is conducting minor procedures at PHC. So these are the important functions of the PHC as per the IPHS guidelines 2022 for PHC based on the services mentioned in the IPHS 2022. So list of services available at various categories of primary health care facility or primary health center is given in the annexer 2 of the IPHS PHC 2022. Okay, it is broadly classified all the functions under general services, clinical services, outreach services, integrated services, that includes preventive, promotive, protective, curative, rehabilitative, restorative and palliative care services, and other office related or administrative services of the PHC. Okay, so all the function I have been explained here is based on the IPHS 2022 services, that comes general services, clinical services, outreach services, integrated services and other services. So thanks for watching. Hope this video really benefits in your studies and exams. So if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video. Thank you.